Good morning, everyone, and welcome to We Got This WA, our webinar series. Today, we are going to be focusing on helping employees with mental health during a pandemic. This presentation, I have to tell you, I've seen a lot of it. The University of Washington provided it in a different group that I was at, and it's fantastic. You're going to walk away with some really helpful tools and ideas and just kind of help process how to support employees' mental health during COVID-19. A few logistical things before we get started. First of all, I wanted to thank our sponsors, Puget Sound Energy and Kaiser Permanente. Their contributions make this possible so that we're able to offer these for free and really make it accessible to all employers, business owners, and managers across Washington. I should have introduced myself. My name is Sarah Childs. I'm the Executive Director for Business Health Trust, and we have loved partnering with the Seattle Metropolitan Chamber on these webinars. A few logistical things right before we get started. So first of all, if you have technical difficulties, please use the chat function. If you have questions for our speakers, please use the Q&A button. I will be watching the Q&A panel and will rejoin the conversation towards the end, and we will get through as many questions, hopefully all, as we can today. So real quick, before we get started, we are going to be talking today about wellness and mental health, which is a huge component there. Business Health Trust has been really trying to be a leader in this area, and we've put together some tools for employers that you can check out. And Lee or Hannah will drop that in the chat, but it's on the Business Health Trust website, and there are two things I wanted to highlight. One, we are doing Wellness Wednesdays, which tomorrow around the noon hour, you and all of your employees are invited to a no-cost complimentary workout session via Zoom. So it's a great way as the fall weather is rolling in to still get some activity. There's no program, just an opportunity to take a mental break and to take care of yourself. And the other thing on there is a flu shot toolkit. So this has some posters, some ideas on how to promote flu shots that are customizable for your company. So take a minute, visit that website, and keep your employees healthy with the flu shot this year. This is the most important flu shot they will be able to get. And check out Wellness Wednesdays and promote that to your employees as a nice break in the day. We've been doing it for a few weeks, and I can say it's a really nice, it's a nice little pause in the day, take care of yourself a little bit, and get a mental break as well. A reminder that this webinar will be recorded, so you can go back and listen to this presentation later. This will be able to be found on the Seattle Metropolitan Chamber of Commerce website. And you'll also get a post-event email that will contain a link there. Okay, that was a lot of announcements and logistics to go through. So now I would love to ask our panelists, our presenters, to turn their videos on and join us.
Hello.
Hello. Happy Tuesday to both of you. And you look like you're on campus there as well. I can see the beautiful view behind you of it looks like campus. That's great. Well, I will turn it over to you to run your slides, Michelle, and rejoin you at the end.
Very good. Well, I'm gonna get it started, and Michelle is gonna drive the slides. Hello, everybody. My name is Jürgen Onutzer. I'm a psychiatrist. I chair the Department of Psychiatry at the University of Washington. And I'm here with my colleague, Michelle Bedard-Gilligan. We want to thank the Chamber for inviting us. We want to thank you all for having an interest in keeping yourselves well, keeping your employees well during this really, really challenging time. Mental health and wellness is something that Michelle and I think about in our day jobs. That's what we do in our research. But we're not any different from anyone else. We're living in the same city, in the same pandemic. We are challenged here at UW Medicine with supporting a workforce of about 25,000 people, all of whom are struggling with many of the same struggles that your employees are struggling with. And many of them have unique challenges in that they're frontline healthcare workers. You know, they're the kind of people who are taking care of the screening, who had to make the lab test in February when nobody had testing and had to stand that up overnight, and then had to take care and are still taking care every day of people who are coming into our hospitals and clinics with COVID-19. So we've learned a lot in the last couple of months about, you know, not just the theory of this, but how to really try to do this. And we're going to try to share a few of the things we've learned, and then we're happy to take some questions. All right, so let's go to the next slide. Okay, just a few acknowledgements. Michelle and I have the pleasure of presenting with you, but we also have the privilege of working with a couple of really great, a couple hundred really great colleagues here at UW in the Department of Psychiatry and Behavioral Sciences, in our Center for the Study of Health and Risk Behaviors, and also the Center for Anxiety and Traumatic Stress. And a lot of what we're sharing is really the cumulative wisdom of a very large group of people here at UW. I just want to acknowledge that. Next slide, Michelle. So I'm going to start with a couple of slides, and they're going to be very basic. I'm just basically doing a mental health 101 for you. Very basic introduction. And then we're going to focus in on one part of this that I think is very, very important, which is the concept of resilience. That's something that Michelle is going to really talk about and delve into a little bit more, and try to help unpack that and think about what it is that we can do in the time of this pandemic to be as resilient as we can be. But I'll start with some basic introduction. So when you think about mental health isn't something you either have or you don't have. Mental health is something that all of us on any given day, it's really, we're on a big spectrum, and that spectrum spans all the way from complete well-being. Things are about as good as they could be. You know, we're happy, people around us are happy, things are good. And on the other end of the spectrum, maybe you have somebody who's really struggling with a severe mental illness, a serious depression, maybe a psychotic illness, maybe terrible post-traumatic stress disorder, and there is no doubt that things are not okay. Everybody knows it, the person knows it, people around them know it, and the truth is it's not you're one or the other, you're somewhere on that spectrum, and any one of us on any given day can be somewhere on that spectrum. When there is a big crisis, you know, what we all do is we experience acute stress, and many of us experience a fair amount of anxiety. And that anxiety can be anticipatory anxiety. So for many of us in February, we weren't sick, but we were worrying a heck of a lot about what might happen to us, to our families. That's anticipatory anxiety. Nothing has happened to you yet, but it can certainly tie up a lot of your bandwidth to worry about stuff. And then you might have something happen and there is an acute stressor. You might have somebody get sick. You might have somebody who loses a job. You might have, those are serious stressful events, and they can be traumatic events. And then you have acute stress and anxiety related to that. And then in the aftermath of that, you would feel things like you might have had a loss. You lost a job, you lost a relationship, and you're grieving about that. And those are all normal human emotions. There's nothing pathological about that. I just want to say that that's really important. Those are things that we all do. And they're normal, and they can be very, very helpful. In fact, if we didn't have anxiety, we probably would all be dead from COVID right now, because anxiety is in fact what keeps us safe, right? Now, if we have a lot of trauma, a lot of stress like this, it may turn into something that's more than just a normal adaptive response. You know, you might have something called post-traumatic stress disorder. You might develop something like a serious clinical depression. And those are not fleeting things. Those are things that are become very entrenched, persistent, and they can be really, really disabling. So a person who has got post-traumatic stress disorder wouldn't just worry about things occasionally. They would have almost persistent, constant worry, can't turn it off, you know, looking over your back, constantly anxious about what's the next thing that's going to come and get me, trying to avoid things that are not really, you know, rationally very scary, but just trying to avoid things because you can't take any more fear, any more anxiety, or having things like flashbacks, re-experiencing things that were really, really traumatic. And that can be just all consuming and really tie you up in ways where it makes it hard for you to go about the things that you'd like to do. And if that goes on long enough, if you have that much anxiety long enough, at some point you can get a very serious depression. You can become hopeless. You can just sort of say, I'm done, I can't cope anymore, I'm giving up. Or you might turn to ways to cope with all that anxiety that are maybe helpful in the short run, but pretty harmful in the long run. So people might be using more alcohol or drugs or other ways of, you know, coping in the short run that turn out to be really bad for you in the long run. So how do we cope? We all have a tremendous amount of stressors right now. We have work-related stressors, we have financial stressors, we got stress in our families, we have our own personal situations, we're in a pandemic, we have financial crisis, we have tremendous social unrest in our country, in our community right now. A couple of weeks ago, I couldn't see out my window because the smoke was so bad. So I cope by being outdoors and clearing my head, and I couldn't even do that. And it was very, very you know, stressful. And then on top of that, we have our own personal health and other challenges. And so how do we cope with that? We draw on something called resilience. So that's kind of our psychological apparatus that we have. And what shapes that? That's shaped by how we're wired, literally. Some of us are more warriors than others. But it's also shaped in a big way by experiences we've had earlier in life with other stressors, with other traumas. How did we cope with those? What happened when we cope with those? We learned some coping mechanisms, and some of us have struggled even before COVID with things like anxiety and depression. Some of us, you know, have really strong coping skills. Some of us have coping skills that under stress aren't so strong. And then in addition to our own psychological coping, we have various degrees of social support. We might get a tremendous amount of support from our workplace. Some of the workplaces have been able to be tremendously accommodating and supportive, others not so much. Our family and friends can be tremendously supportive, or we might be getting professional help from somebody. So those are all, you know, what we have in our tool bag to cope. Next slide. If you look at from a population level, and some of you may have seen this graph, actually, the state has put this graph out in a couple of their publications about the pandemic. There is some knowledge about what a population experiences when a big disaster hits. So let's say a natural disaster or a 9/11 or some big disaster hits. And the pandemic we're in is not exactly a great example of a disaster because it's not a disaster that came and goes away. It's still going on and we don't quite know what the end of it is. But this is kind of helpful. So early on in a big challenge to a whole population, what you see is people step up. You know, they're like, we can handle this, we can do this. They rally. There is kind of a honeymoon phase. And I think we saw that this spring. People did that in our community. And I think we all felt pretty good about how people were just saying, hey, we're gonna handle this. We're gonna step up, we're gonna handle this. But now this goes on for a long time. And at some point, you know, that can start breaking down and you become really disillusioned. And the blue arrow is kind of where I think we are as a community right now. We're headed into a winter. We're seeing the numbers going back up. We don't yet see an end in sight, and people can sort of say, wow, you know, this is terrible. I don't see an end. This is just getting worse. And we can get into a pretty big funk, a pretty big trough as a population. And then you start working your way back out of it. And eventually this challenge will go away and we'll you know, work our way back out of it and we'll find a new beginning. So that's maybe a curve that applies to a population. On the right side, I have a couple of things because individuals aren't all following this curve. Individuals can have any of the things that I put there on the right side. Some of us are in shock. Some of us are in denial. Some of us are still rallying. We're like, I'm energized by this. I'm making changes. Some of us are angry. Some of us are grieving. Some of us are just totally disillusioned. Some of us are so anxious we can't really focus on anything very much. Some of us have had such traumatic life events that we really do have post-traumatic stress disorder. And some of us are depressed or using a lot of substances. Some of us are starting to have a hope, and some of us are actually saying, hey, I'm seeing some things that are not all bad. I'm seeing some growth in this. There are some things that have happened in my life that I think I don't want them to go away when this is over. I'm really seeing some growth. So those are all possible. Those are all emotions that and reactions that we might have as individuals. Next slide. So how do we respond to this crisis? So the most important thing, I already said this, I'm going to say it one more time. Stress and anxiety are not bad. They are normal. And most people who are going through a stressful experience don't develop post-traumatic stress disorder. So the very first thing we can do is when you have a person who is in a crisis, we like to use a concept called psychological support. That's sort of the first aid equivalent of helping somebody with a mental health crisis. And it's not fancy psychological stuff. It's basically very concrete, practical things. You say, what do you need right now? What do you need to get through the next few days? What do you need to be safe? What do you need to make sure that things don't get worse? Very basic, practical stuff. Don't get too complicated, too fancy. Don't process all the stuff that's going on. Just focus on the right now, what do you need? That can be super helpful, and all of us can do that kind of thing. The next level really would be to say, wow, this is going to go on for a while. How do I help this person develop resilience? And Michelle is going to really focus on that in her comments. And what we're talking about there is really the ability to cope with these challenges, to really rise to the challenge, and maybe even come back stronger than you were before. A lot of us do have something called traumatic growth. You can grow in the middle of a challenge. The other thing that I think is really important is this is a high-risk period. And so one of the things we can do for sure is to say, how do we prevent things from getting even worse? How do I reduce the risk that I'm going to cause myself or other people a bunch of harm during this high-risk period? Substance abuse is a great way to try to cause yourself or someone else harm. If you get into a really serious addiction problem, or your drinking gets a lot worse, you might be damaging some relationships and some things in your job now that are hard to recover from. So I would just say harm reduction, reducing additional risk is a pretty important thing to keep in mind. There are some of us who aren't going to be okay with psychological first aid, or with thinking about our resilience. Some of us are going to have serious problems. We're going to have serious depression. We might have thoughts of suicide. And if you have that kind of a crisis, you're not talking about first aid. You need to get some real serious help. So if you're in a really life-threatening crisis, you call 911. You say, I'm really struggling. I'm worried about myself, about someone else. If you're in King County, you can call the King County Crisis Line 24/7. You can text them. You can email them. It's a great resource. And you're talking to somebody there who is pretty good at talking to you in the middle of a crisis and helping you figure out what can I do right now. Many of you have other options for your employees. You might have an employee assistance program that can offer counseling, that can help a person with problem solving, with some coping skills. Some of you, will want your employees or yourselves to get more than that. You might get serious mental health care. You might want to see a psychiatrist, a psychologist, somebody like Michelle or I. That's what we do. And what we would do is we would do a really good assessment to figure out what are we up against here? What is this person really struggling with? We might do some counseling or psychotherapy, or use medications to help somebody who's struggling with a serious mental health issue. And the good news with that is mental health care, even professional mental health care, has become a lot more portable than it used to be. You don't have to go to someone's office and sit on a couch. We now can do mental health care in person. We can do it virtually. We can do it via telehealth. We can do app-based or app-supported care. There are a lot of options. So I would say this is a good time for somebody who's struggling with a serious mental health problem to get some help. Next slide. So my last slide here is, what can you do as a leader? The most important thing you can do is just be there and stay there and keep being there and listen to your employees. Be kind. This is a time where everybody's struggling. Nobody's doing great. Validate what people are telling you, value what they do, embrace reality, acknowledge that we have some serious challenge. Don't let small problems pile up. If they pile up too much, that's when people get overwhelmed. Keep trying to solve the small problems. And, have some hope. We can get through this. We can adapt from this. We might even come out of this better than we went going in. Communicate with people, have a couple of clear principles. What's important to you? You want your employees to be safe. You want to remember your mission, your customers, your clients. In our case, we have students, we have patients. That keeps us grounded if we keep focused on that. And a couple of key principles like that, important to remember in your communications. Look for those of your employees who might be particularly vulnerable or at risk. So somebody who was already struggling beforehand, somebody who is a new employee and has never even come into the office and is doing everything by Zoom. That's hard. That's really stressful. Somebody who might be living alone or who is displaced by the pandemic or God knows what. Those are high-risk people, and look for them and see what you can do to help them. And then I think the most important thing is take care of yourself, show others that you too are stressed, your family is stressed, and if we all take care of ourselves, and then when we have a little energy left, we look into take care of others, it can make a huge difference. Next slide. So that was a very quick intro, Mental Health 101. And now I'm going to ask Michelle to take over, and she's going to unpack a little bit for you this construct of resilience, which is a really, really helpful, powerful construct. So Michelle, go ahead.
Thanks, Jürgen. Good morning, everyone. Thank you for being here. As mentioned, so I'm Dr. Michelle Bedard-Gilligan. I'm a clinical psychologist and faculty at the University of Washington, and I co-direct the Trauma Recovery Innovations Program. So what I'm going to be presenting today is some materials that we've put together and some content we've put together that we've been using at UW and elsewhere in terms of helping individuals think about how they can build resilience and how they can intentionally work to being as resilient as possible during the current crises that we're all kind of shouldering through. And so what I'm going to present is some content on that. And I think ideally, the idea is that you'll be able to think about how you might apply it to the companies you work at and the employees that you're wanting to help and support during these difficult times. And I think if you take anything from today, I hope it's that this idea that these things can be taught. As Jürgen was talking about, this is a difficult time for all of us, and all of us are having to learn new ways to cope and adjust. And we can do that, we really can, but it does take effort and intentional effort to make those changes. So first, I want to start by actually defining resilience. And as Jürgen mentioned, it's a really powerful construct, this idea of resilience, and it's a word that's being tossed around a lot right now. And what do we mean when we talk about resilience? So the reality is that we are currently living in a time of increased stress, incredible stress for many of us. We are being exposed to, chronic levels of stress that many of us have not experienced before. In addition to that, we're being exposed to repeated periods of acute distress. So within this kind of period of everything just being more challenging, we're also seeing periods of time where stress goes up because something happens, or because, like Jürgen was talking about, COVID rates increase, or something else happens in terms of some of the social justice movements that are going on. Just a lot is being thrown at us. And so we are going kind of up and down on this roller coaster of having to tolerate adversity in a way that might be new for many of us. But the reality is we all face adversity, and we all face adversity at some point in our lives. Some of us more than others, but we all face it. And when we think about resilience, what we really we think about it as the process of adapting well despite that adversity. So it's the process of continuing to keep going, continuing to move forward, and making the changes that we need to make to adapt and function as well as possible despite the adverse circumstances that might come up. And we know, just like all of us experience adversity, we also know that resilience is the most common outcome. So when we are exposed to adversity, the most common outcome for most of us is to be resilient, to adapt in that way that enables us to keep going and to keep functioning. And so we really do expect most people to be resilient during and following COVID-19. And this is an important message to get across, both to yourselves and to the people around you. But equally important is the acknowledgement that resilience is not clean, and it's not necessarily a straight line. We say resilience is incredibly messy. It's variable and it's nonlinear, meaning it goes up and down, and it doesn't necessarily go in a straight line. It's not this idea that things get hard and then they get better. Resilience is this. It's up and it's down. And so it does not mean that there's no distress along the way. As Jürgen was saying, experiencing stress and anxiety and negative emotions in response to the things going on in our world right now is completely expected. And so we really don't necessarily think that resilience is not the absence of those reactions. It's the ability to weather and tolerate those reactions in a way that enables us to keep going. And resilience is intentional. So it is not something that people have or do not have. Resilience is actually something that we build. It requires effort, persistence, and patience. So it's something that we can learn and require, but it does take intentional effort and practice to do so. And for some of us, acquiring and building resilience is going to be easier than others. So for some people, they have more vulnerabilities, and Jürgen touched on this as well, but there's a number of things that we think of that will contribute to someone being more vulnerable to not being resilient. So just struggling more to be able to adapt to changed and adverse circumstances. And so really being aware of the things that'll put either yourself or those around you at risk, to be able to identify who are the people who might need a little extra help in terms of bringing out their resilience. And because we know that some of us are more affected than others, we really argue that it's very important to think about resilience at the community level. So to be paying attention to those around us and how resilient or not resilient they are seeming, because when we bolster the community, we actually bolster all of us. And so you are all here today because you're thinking about how you might better support your workforce and better support your employees and those in your work communities in regards to coping and getting through all the adverse circumstances that 2020 has brought. And so the reality is we know this, right? We know that by helping others, we can help ourselves as well as sort of just helping the whole community, whatever that means to you, move forward in a way that's adaptive. And I like to show this quote because I really think it captures very, very well what we mean by resilience. Because like I said, resilience, is strategic, it's effortful, and it's intentional. And it's not about not suffering. It's not about feeling no pain. Resilience is instead, as this quote said, about being adapting and accommodating rather than resistant to the suffering. I think that's what it's like to live through that's what it is to live through hardship for sustained periods of time. So it's this idea of being able to weather the pain that is expected during really adverse circumstances, to be able to tolerate it, to adapt and to accommodate it, as opposed to getting rid of it altogether. And so what are the things that we think you can do to promote resilience? And what we're going to talk about are some of the strategies that we've found are most helpful in terms of dealing with these adverse circumstances and being as resilient as possible. And I think the idea is that these are strategies that you would apply to yourself in order to increase your own resilience, but also can think about how they might be applied to those around you in your communities and to those close to you to help them build resilience as well. And so we focus on what we call the 3 A's, so assessing, accepting, and adapting. So the first thing that we talk about when we're trying to build resilience in times of high adversity or stress is being able to regularly assess how we are doing. So it becomes very, very crucial to do regular check-ins with ourselves about what are the things that are going well for us and what are the things that are going less well for us. So everything from how are we eating? How are we sleeping? What is our activity level like? What is our level of connection like? Are we seeing people that are important to us? What's going on inside of us? What are the negative thoughts we're having? What are the negative feelings we're having? The flip side of that is what is the positive feelings that we might be having as well? What are the positive thoughts that we might be having? We do know that for individuals who are resilient, one of the characteristics they tend to have is the ability to see the whole picture. So to be able to see the negative and the positive at the same time. And it's not just counting the negative, but it's being aware of the positive as well. And so when we're doing these temperature checks, we're being really careful to look at the whole picture of how we've been doing in any given time period. How are we doing today? How are we doing the last hour? How are we doing this week, right? I'm doing regular check-ins to keep apprised of how things are going for us during these really challenging times, and being aware of ways in which we might be coping in less adaptive ways. So Jürgen talked a little bit about substance use, and that's up here as well. So checking in with ourselves, are we doing things to try to avoid the pain and try to avoid the suffering, like substance use, when in reality, we might be better off. That might be causing more problems than it's solving. So really thinking about doing this assessment of what's going on for us, what's working well for us, and what's working less well for us. And doing this regularly. We need to, during periods of crisis, when things are going up and down in terms of stress levels, really be thinking very often about what ways are our needs being met and in what ways are needs not being met. And so again, what is going well and what is going less well. In addition to doing those regular check-ins and doing those assessments on ourselves, we also need to think a bit about acceptance. So this is our second A. During periods of high adversity, the reality is that there are going to be things that we cannot control and things that we cannot change. And so we really need to be focusing on this very intentional acceptance of being able to identify what are the things we can change and what are the things that we might need to let go of. And so doing this process of asking ourselves, whatever this problem is that I'm dealing with right in this moment, is this something I can do something about? If no, how can I let it go and focus on something else? If yes, what are my options? What can I do about it right now? And really thinking about what you can do to solve that problem. And if there isn't anything you can do, then figuring out how you can refocus your attention somewhere else to not get sort of sucked into that spiral of focusing on the things we can't change. Instead, accepting that during these periods of really high stress, there might be more things that we don't have in our control than we are used to, and figuring out ways that we can accept and tolerate that. And so when we think about acceptance, we really mean this process of being able to acknowledge our new normal and what are our reactions to it. So for most of us over the last 7 or 8 months, our reality has shifted quite dramatically. And so what is our new reality, and how can I accept that for what it is? Doesn't mean it'll be that way forever, but how can I accept it for what it is right now? And when we really think about where our reality has shifted and what we need to accept, we have to think about the things around unavoidable changes, the things that we can't control, the things that we can't change, the negative emotions, and the loss of control that we might be feeling. And how can we accept that that might be our reality for at least a while? But we also need to be focusing on, again, to see the whole picture, the positives of the new reality as well. As Jürgen said, many people are experiencing increased recognition of things that maybe ways they have grown, or things that have actually become more clear to them during these last 7 months of difficulty. And so really noticing, what are the ways in which you coped well? What are the ways your strengths or your resources really came out? Perhaps there's strengths and resources you didn't even know you had. And so being able to accept that, and again, it doesn't mean that things aren't difficult. It just means trying to see the negative in conjunction with the positive. But it also means acknowledging that this is really hard. And so there is a lot of negative. And so being able to, do good self-care and treat ourselves with as much compassion and tolerance and patience as possible is another way that we can accept. We can accept that we may need to be kinder to ourselves and put more effort into caring for ourselves than is typical for us. And so accepting that things are hard and they're going to be hard for a while. And then finally, the last A of adapting. So adapting is really about, was really about how can we, once we've sort of assessed where we're at and we've sort of accepted our new reality, what changes do we need to make in order to be as functional and as well-adjusted as possible, given all the things that have changed for us. So how do we adapt? And this is where really intention, planning, and flexibility become key. So we may have to pay closer attention to things that we didn't used to have to pay attention to. So for example, we may have to set a completely new routine around when we sleep and when we eat and when we work and when our kids go to school than what we're used to. And we have to adapt to that. And we have to come up with a new routine that reflects the present circumstances, as well as maybe adapting to how can we stay active? How can we not avoid? How can we still stay engaged in the world, despite the fact that it's really different than it used to be? And how can we adapt to that? And often this involves putting increased focus on how we can engage in positive activities. So what are ways that we can promote positive activities that maybe, again, we didn't have to put a lot of intentional effort into before, but now we do because things are different. And so what are the ways we can adapt to our circumstances and come up with things that will actually make us feel good despite the difficulties and help us get through. Adapting can also mean having to manage distressing reactions. So as we mentioned, a lot of people are experiencing more negative emotions currently than they are used to. They're having to tolerate more negative feelings, and having skills to be able to manage those as they come up may be something that people need right now. So this is an example of a breathing skill. It's similar to a meditation skill or yoga or mindfulness or any of those things that are often kind of out there in the popular universe. And it's about being able to manage our distressing reactions by changing our physiology and by focusing on something like deep breathing. But adapting can also be around sort of feeling and tolerating the distress. So we are having more negative emotions. And so we don't necessarily need to always work to eliminate those. And in fact, we don't want to always work to eliminate those. And so sometimes engaging with our feelings is actually the most adaptive thing we can do. And again, this may be something that isn't necessarily default for you. It may not be something that you've had to do a lot in the past. But now with more negative emotions than you're used to, being able to process those emotions by doing something like a simple writing exercise that's outlined here can actually be a way to, like that quote I presented earlier, accommodate the suffering and the pain as opposed to being resistant to it. And often in terms of adapting, that is something that actually is really important. We also may have to be checking in with ourselves about how we're making sense of the circumstances around us. So this can involve challenging unhelpful thoughts and not treating them as facts. So a lot of how we feel and how we interact with the world is influenced by the meaning we make out of things. And so during periods of high stress, we have to be careful to really check in with ourselves about how we're making sense of things and what meaning we're attributing to different things that are happening around us. And so it may be asking ourselves questions like, okay, the way I'm making sense of this situation right now, I'm feeling pretty sad or angry or hopeless. Is there a way I could think about this in a more helpful way? Is there something I would say to a friend if they were thinking the way I'm thinking? And so, because often our thoughts can be driving factors in how we feel, but it doesn't necessarily mean that our thoughts are completely accurate. And so being able to take a step back and asking ourselves, why are we thinking the way we're thinking and is it helpful, can be really crucial in promoting more adaptive meaning in current stressful circumstances. It can also be about being able to distinguish normal and unhelpful worry. And so worry is a normal part of life. And many of us are doing more worry right now than what we're used to. And so really being able to distinguish worry that is helpful, worry that protects us. It helps us get what we want. It helps us to solve problems. It helps to keep us safe from the kind of worry that is excessive or unhelpful. And that's the kind of worry that's marked by leaving us feel pretty demoralized or upset, and it gets in the way of living the life we want. It keeps us stuck. And so when we're having that kind of worry, it goes back to trying to figure out ways that we can accept the things that we can't control or the things we can't fix, and perhaps using some other type of skill like positive activities or engaging with negative emotions, using some kind of writing exercise or deep breathing to try to get us out of that cycle of excessive worry. And then finally, we think about, in terms of promoting resilience, increasing our social and our community connections as being really crucial. And so really checking in with ourselves about humans by nature are social creatures. And so checking in with ourselves about the ways in which our social needs are being met and the ways in which they're not. And so who are we going to for support? Who are we sharing our feelings with? Who are there people out there that we can help? Because often that can be a way of improving our resilience and our the way we're adapting as well. And particularly if you're in a leadership role or you're thinking about your employees, we can think about how we can help our team members or those working around us adapt. And some of this is about communicating with calmness and compassion and respect, giving a safe space for individuals to struggle because things are really hard right now. Being able to maintain professional boundaries, to be able to listen to concerns and respond to those concerns by staying in your current role, sharing information as openly and honestly as you can, and helping individuals troubleshoot any challenges they might have to adapting to the current circumstances. And being able to do these things while staying in your role as a professional or your role within your employment setting is really good modeling for how to be resilient and how to sort of adapt to current circumstances. And so we do think that these three skills, these assessing, accepting, and adapting is one way to promote long-term resilience, and keeping in mind that that is the most common outcome. That is what we expect for most people. And we also think that by working to cope effectively with crises as they come up during these periods of really increased stress, we actually can build skills. We can build our resilience muscles, if you will, to promote future resilience down the road. And so the last thing, I want to make sure we leave lots of time for questions. So I'm going to very quickly just touch on a few resources for individuals who need more support. So as Jürgen mentioned, there's a spectrum of individuals and of how individuals are going to be doing right now. And when we think about resilience training, we really think about bolstering our resources. For those of us who are struggling in ways where it's hard and it feels really hard and maybe we're impaired, but we're still sort of putting one foot in front of another. And for those individuals for whom that process has become too hard and they feel like they need more support, I just want you to be aware that there are a lot of options out there. So these are some of the psychological approaches that are either evidence-informed or evidence-based that can be delivered by a trained support person to help some of the more heavily impacted. So things like psychological first aid and skills for psychological recovery, and then cognitive behavioral therapy for mental health disorders. These are all things that we roll out at the University of Washington that our providers do regularly, as do providers at lots of other organizations, and they can really make a huge difference. And these types of approaches, particularly when they're delivered during current crises like what we're going through now, are generally short-term, skills-based, targeted type interventions. This is not usually therapy for years. This is sort of problem-focused approaches that can really help move people forward when they're feeling stuck and the resilient skills that we've been talking about are not enough. And so I'm not going to go into them too much just for the interest of time, but psychological first aid is delivered in the immediate sort of impact of a crisis, and it really focuses on being able to kind of increase one's ability to cope during those initial days. So we use this a lot at the very beginning of COVID. Skills for psychological recovery is a slightly more intensive approach, and it's actually one of the approaches that we're using right now. Again, this is for individuals who haven't necessarily developed what we would call severe mental health problems, but they are struggling and they need more than what they can do on their own. And so this is working with a trained provider to help build those skills that'll help make them resilient. And then finally, we have cognitive behavioral therapies for mental health disorders. And we have years of evidence to suggest that following trauma exposure, including the kind of circumstances that we're all living through right now, that these kinds of cognitive behavioral therapies are really helpful for a lot of people. And these are more intensive. So these are for individuals who are really suffering to be able to do things and to cope on their own. And so we just want you to sort of know about those resources as someone in leadership and as someone who has a role in an employment setting where you have influence over other people, knowing that you can normalize the need for support and that you can, within your professional boundaries, make suggestions or provide recommendations, and that there are things that can be done to help individuals who are really struggling. And so, I think the take home is that resilience is expected and is hard. And so there are things that we can all do to make a difference, to build our own resilience and to build the resilience of around us. And that when we can find ways to make meaning, to engage with others, and to foster compassion, we really increase our chances of being able to come out of the crisis like we're currently in as resilient a way as possible, adapting as functionally as possible. So I'll put up a slide that just talks a little bit about some more support resources and referrals. Some of these are UW specific, so they're much less helpful. There's an email address on there as well if you ever wanted to reach out to me too. So thank you very much. And I will stop sharing my screen now, and I think we're happy to take questions.
Yeah, wow, so helpful. I really appreciate all of the really practical tips and things that you helped walk through and start to have employers think through, and some tools. So my first question is, how as an employer or a manager are you supportive of your employees' mental health without overstepping or being nosy or crossing the line? How could you talk a little bit about that?
Well, let me start on it, and then Michelle can jump in. I don't think, I wouldn't be too worried about, risking it. It's okay to say this is a super stressful time for all of us. It's even stressful for me. It's stressful for my family. Let me know, let us know if there's something that we can help with. This is a time where you can normalize that it's okay to say, I might need some help, or at least I need to talk to somebody about what's going on. So I think maybe that's the most important thing. I wouldn't be overly worried about offending somebody by suggesting that this might be a really stressful time. This is actually maybe an easier time than ever to bring that up. Michelle, anything else you want to say?
Yeah, I think I agree. I completely agree with that. I think the normalization piece is really, really key and actually really easy to do right now because most of us are struggling. And so it's pretty easy to be really genuine in saying, it's hard for me too. And I think, some of the reason that we go through these resilience skills is also with the idea that if we use them ourselves, we can model that for people around us. So if we are using some of these skills or being open about the things that we're doing to increase our ability to withstand the current crises, people can see that and they may take some of that in and change their own behavior as well, which I think could be really helpful. And then I think the last thing I would just say is just knowing your limits. So, it's okay to say, I don't know. It's okay to say, I don't know the answer to that, or I'm not sure. And, instead help the person figure it out. We don't have to, our job as, within an employment context is not to solve problems. It's just to help people feel empowered and help give them support to solve their own problems. And that's resilience, is being, is that process.
And then maybe just one thing to add, I would say many of the things you heard Michelle talk about, I use them in almost every meeting, almost every day with employees. So we have a department, that has about 1,000 employees, and every single one of us is seriously inconvenienced at a minimum. Some of us are a lot more than inconvenienced. Some of us are going through tremendous challenges, crises, and all of that stuff piles on, and people bring me this stuff every day. They bring me, and I have to sort. Is this an inconvenience? Is this a crisis? Is this something? And I have to think about this acceptance thing. I have to listen and I have to say, all right, is this something that you or I can do anything about? And if it's literally crystal clear, there's nothing we can do about it, I say, is there a way we can let go of this? Can we focus on something that we can do something about? So some of the stuff that Michelle talked about, you can use that, almost in every one of your interactions. Those are very concrete, helpful skills.
Yeah. And once you get Jürgen and I talking, we just talk. So you can cut us off at any time, but
love it.
In one of the teams that I manage, we actually start we have a regular Monday weekly meeting, and we actually start it with a resilience word. So we popcorn around and everybody gives one word that personifies what they're doing about their resilience that week, like what they're focusing on. So sometimes it's exercise, sometimes it's support, sometimes it's family engagement, sometimes it's persistence or hope, or whatever it is, and then a very brief description of what that looks like for them. And it's just a way of kind of reminding all of us that this is work and this is hard, and we're all doing it in our own way, but we're all doing it. And I think it's been really useful.
Yeah, that's really good. I love that exercise that you just talked about. So Jürgen, you were mentioning, if there's something outside of your control and, there's no possible way it's in your control, how to let go or to let go. How do you coach people on building that skill set to be able to let things go, especially when, things seem like they will not go away? So how do you mentally kind of get to that spot?
Yeah, so there's a concept called acceptance or radical acceptance. And I think this is the time for all of us to get really good at that. There is a bunch of stuff that we cannot change. We cannot change the pandemic. We can do things within it, but there are some things that are coming at us right now. We cannot change them. And You just have to say, if I can't do a thing about this, literally nothing, and if nobody else around me can do a thing about it, how much time will I give that? How much of my mental bandwidth, my mental energy will I give that? Or are there things that I can do something about? Maybe I need to really focus on that. And I think having examples of that, demonstrating that, and then showing what you can do, it's really important. There's a concept called problem solving, and you teach problem solving skills. And problem solving isn't that you're going to solve all the problems. It's really when you get really stuck, when you're getting really depressed, you start solving little problems. You don't like things pile up. And once you solve 3 little problems in a row, you go away from this notion it's all lost. There's nothing I can do. You start saying, hey, I did these 3. Maybe I can do this other thing. And then you hit one where it's like, there is not a chance that you can do something about it. Then you go back to saying, maybe I got to put that one out of my mind for a while. There's nothing I can do about that. So I think it's something that we all sort of do, but you can practice it and you can be a lot more deliberate about it.
That's really helpful. Just a reminder for everybody, this was recorded and will be available on the Seattle Chamber registration page. Lee will also be sending out an email after this webinar that will have a link to this and feature some of the information that Michelle had at the end of some of those resources and contact information as well. As I wrap us up, I just want to encourage everyone to put some of these practices into effect this week as you start to go. I'm sure everyone will have an opportunity to engage with one of their employees or coworkers today. And it's a really great chance to exercise maybe one of the tips and skills that they were talking about today. So I will take that challenge myself as well as I go into 4 hours of Zoom, which I think we can all relate to. It's like, whew, this is going to be an afternoon, but you know, a good opportunity for resilience and to figure out how I can build that skill as well. Well, thank you both so very much. And Lee told me we just have 2 questions come in. Okay, so let's see. For anyone that might be resistant to seeking assistance, do you have websites or books to recommend?
That's a great question. Jürgen, what are you, anything coming to mind right off the top of your head?
There's just a ton of stuff on the internet. Some of it is super helpful. Some of it is pretty crazy and not so helpful. That's how the internet is, right? And people will find the things that they're interested in, that they're finding. So sometimes it's just a matter of saying, what have you looked at? Have you found it helpful? And then it'll give you a chance to engage with somebody about a dialogue.
Yeah, you know, the Anxiety and Depression Association of America, ADAA.org, has some great resources, videos, and pamphlets and handouts for individuals who might be interested in more sort of support, like professional support. I think that's helpful. There's also a couple of really great TED Talks on resilience, where they talk just about coping with adversity and what are some of the commonalities for individuals who are resilient. That's more on the other end of the sort of not professional help, but more sort of individuals who just want to hear more about increasing resilience. I'd recommend those as well.
The other thing I might say is, you know, you don't have to, if you get brushed off once, it doesn't mean, you don't have to be overly obnoxious, but it's perfectly okay to say, come back to somebody and say, you know, I just wonder if you need to be suffering this much. You know, it helped me a lot when I got some help, or it helped somebody a lot when they got some help. And come back to it a couple times, you know, and if you're still there, at some point they're saying, boy, that person isn't going away. They must care because they're still there and they're still caring about me. And at some point, if you're in enough pain, if somebody says, I just wonder if you need to be struggling, suffering so much, at some point, you know, people might be a little bit more open to hearing it.
Yeah. Are there any sort of like mainstream platitudes or approaches to stress or resilience that are actually not helpful and should be avoided?
Yeah, it's a great question. I'll go first this time, Jürgen. You can jump in. I would say think positive, just think positive, just try to see the bright side. It's generally not very helpful. The idea, we do want to increase positive activities, and we often do want to question our thoughts when they're too negative, but the idea isn't to be Pollyanna or to just replace it with all positive, because trying to convince ourselves that things are more positive or better than they really are tends to be unhelpful and can actually make things a little bit worse sometimes. I would also say I think there's the myth out there that negative emotions are to be avoided at all costs, that negative emotions are dangerous, that nobody wants to feel them and we shouldn't feel them. And that's just not true. And in reality, learning that we can tolerate negative emotions, learning that we can feel really sad about something and have that normal human reaction, and we can tolerate that and get through that, is incredibly powerful. And so we don't want to just push negative feelings away all the time. We want to, at times, engage with them or talk about them. And that is generally more helpful. So I would say that's another one.
I think that's really well put. I don't have much to add.
Well, thank you both for your time today and for this presentation. I look forward to connecting in the future and hearing from those that have participated today and how it impacts the way that they're able to show up for their employees and care for their mental health. Take care, everyone. Bye-bye.
Thank you.
Thank you. Thanks for having us.
Yeah, thank you.